It's Plush Tonight, showcasing the latest in professional spa treatments from Plush Medical Spa, Westgate Parkway, Dothan. With owner and medical director, Dr. Amanda Bell, board certified in internal medicine. Here's Dr. Bell with your host, Barbara Kennedy.
Hi, I'm Babs Kennedy. Welcome to Plush Tonight. I'm here as always at Plush Medical Spa with Dr. Bell. Hello, Dr. Bell.
Hi, everybody.
On this episode, we'll be talking about dermal fillers like Juvederm and Restylane, and you will get to see a real patient having filled place in her cheeks and lips by Dr. Bell. This is going to be good. I'm excited.
I'm excited too.
So remind us about the services here at Plush Medical Spa.
Well, let me remind everyone that we're located at 548 Westgate Parkway in Dothan, next to the Butcher's Block and across from Westgate Parkway. You can always find us on our website, plushmedspa.com, and be our Facebook friend to find out all about our specials and any rebates or discounts we have going on. You'll be the first to find out if you're our Facebook fan. Here at Plush, we have two estheticians, Katie and Rachel, who do all of our facials and skincare consultations. They do the microdermabrasion and the chemical peels. We also carry all Obagi medical skincare lines and Jane Iredell Cosmetics. In fact, we have the largest selection of anywhere around Dothan. We do manicures and spa pedicures here. We have a very nice nail room with a big screen TV, and we have free Wi-Fi throughout the spa. So you can bring your laptop and surf the web while you have your pedicure, or just kick back and relax with us, and we'll take care of you. We do face and body waxing. We wax all parts of the body, including the chest and the back for men. We do legs and arms. We do eyebrow waxing, and we also do bikini waxing and Brazilian waxing. We have 2 massage therapists here at all times, and we try to hold 2 spots open every day for call-in massage appointments for people who need special care right away. We do Swedish, deep tissue, hot stone. We do prenatal massage, and we even have a great couples room where we do couples massage and even couples facials. I am responsible for doing the Botox and Dysport injections here, and I also do the dermal fillers that we're going to be talking about today. Those are Juvederm, Restylane, and Radiesse. And I also do Thermage skin tightening treatments for tightening loose skin in the face and the body. I see patients to dispense Latisse for eyelash growth and Retin-A and other skincare medications. So we do quite a lot.
Wow. Well, let's talk about the dermal fillers. I mean, what are they? Describe to us about that.
Dermal fillers are materials that are injected into the dermis, typically the deep layers of the skin, to improve the look of deep wrinkles and minor surface wrinkles. The main area of the face we tend to use dermal fillers on is the lower face. And the most common area to get filled is the nasolabial folds and the so-called marionette lines. By and large, those are the majority of the areas getting filled here at Plush. But another really popular area to fill is the cheeks for volume replacement in the mid-face. Barbara and I have both had our cheeks filled. So we have great bone structure, which we know is actually filler. But it can drastically improve the look of the under eye area and the lengthening that comes along in the lower lid from volume loss in the mid-face. It also can improve the nasolabial fold area by pulling on the skin adjacent to the whole cheek area.
Actually, it can lift up the whole bottom of it, because when you fill this up, it starts to lift everything up, doesn't it?
It does, and what most people notice, aside from the fact that their face now has a nice V shape to it, is that there is thinning underneath the cheeks, and it gives you a very nice chiseled look under your cheekbones, which I personally never had before until injecting my cheeks. The other area that's very popular for injection is the lips. Most people only notice lip injections when they've been done poorly. When they are done well, they are not noticeable and do not look bizarre. There are certain simple rules, if followed, that will give you a very good result without having your lips look like swollen sausages pasted on your face.
What can patients expect after the procedure, like the day when they have the procedure done? Well, first of all, do the needles hurt?
Yes, the needles do hurt, so we do a so-called dental block, like the dentist does, with an injection inside the mouth to completely numb this area when we're filling the nasolabial folds, the lips, and the marionette lines. Trust me, you want the block. Getting the block allows us to painlessly put the filler into your face or your lips. And while the block is the most difficult and painful part of the procedure, it is very quick. It's over in the initial parts of your treatment, and so therefore it's all downhill after the block. The blocking material we use for numbing is lidocaine. Most dentists use epinephrine in their lidocaine, but we do not. We don't need it to last as long as the dentists do, and with using epinephrine there's always a greater chance of side effects and effects on people that are sensitive to that drug. So we use regular lidocaine, and therefore when you wake up, so to speak, from the numbing process, you don't have that achy, strange feeling like you just want it to wake up already in the way you do most often when you leave the dentist's office.
So what do you expect after the procedure? Is there bruising? What will the patient expect after that?
Most people do not bruise unless we happen to be filling the marionette area. That area is notorious for bruising. There are a lot of venous vessels coming off from the sides of the mouth near the surface, and so if any area is going to bruise, that would be the most likely. It is possible to have bruising in any area, but the area least likely to bruise is the cheeks. In fact, when we augment the cheek area, we don't even require that you have a block. The block is actually more uncomfortable than injecting the cheeks without it.
Actually, it is, because I tried one side with the block. The block was what really hurt, and then the other side I didn't do a block at all, and it was fine. You don't really need a block on the cheeks at all.
No, I'm the biggest pain wimp there is, so if I tell you you don't need a block for injecting your cheeks, you really don't. But afterwards, all in all patients included, all areas included, about half of people bruise. Now, if you tend to be a person who bruises, that bruising may be significant. If you tend to be a person who doesn't bruise, most likely you will not bruise from filler. Now, there are some people out there that are on blood thinners like aspirin and Coumadin, and for very good medical reasons. It's not necessary for you to come off of those medications before having filler, but it certainly does lessen the likelihood of bruising if you are able to come off of those drugs. Certainly that would be something you'd want to talk to your primary care doctor about before ever stopping any medication simply to get filler. But that being said, it's best to avoid nonsteroidal anti-inflammatory drugs like Motrin, Aleve, any sort of ibuprofen or naproxen, and aspirin before these procedures, because they will make you more likely to bruise.
After the procedure's done, how long will it last?
Well, it varies between the area that we treat and the filler that we're using. The older fillers are made of hyaluronic acid, and those are the Juvederm and the Restylane. We tend to use those fillers for the lips and the fine surface lines around the lips. Because they're made of hyaluronic acid, they're more of a clear gel and tend to be softer and more flexible and more gel-like, as opposed to the Radiesse filler that we use for deeper filling. The Radiesse filler is made of calcium hydroxylapatite crystals and lasts for much longer than the Juvederm or Restylane. Typically, when placed in the lips or the nasolabial folds and marionette lines, Juvederm or Restylane will last about 6 to 12 months, depending on the motion of the area, how much you talk and smile, and how quickly you metabolize things in general. The Radiesse filler I tend to use for the nasolabial folds and the marionette lines, as well as the cheek augmentation. Can also be used to rejuvenate the dorsum of the hands, and we get very nice results with that. The Radiesse filler is never used in the lips by and large because it's just too thick. It's more of a soft silly putty versus the gels that Restylane and Juvederm are. But to answer your question about price, it's difficult to answer because the syringes come in different sizes, and so that makes comparing price per syringe a little bit difficult. But our price does include the numbing procedure, the dental block if needed, and any post-care and follow-up appointments that you will have. In general, the Radiesse, the thicker item, comes in a 1.5 milliliter syringe. That's roughly double the volume in a Juvederm syringe. Juvederm syringes are 0.8 milliliters, and Restylane is 1 milliliter, but the Radiesse is 1.5 milliliters. So, of course, the syringe is more expensive than the Juvederm or Restylane. A Radiesse syringe is $650. Juvederm runs between $450 and $525, and the Restylane is $400. So the price per milliliter with Radiesse is actually cheaper than the Restylane and Juvederm. Restylane and Juvederm don't last as long as Radiesse, especially when placed in the dermis in these areas. The data tell us that Radiesse lasts at least 18 months, probably 18 to 24 months in most people. So you're getting roughly double the time out of Radiesse than you do with the other fillers. And it, like I said, it's thicker and tends to give a better result for especially deep wrinkles. The Radiesse itself is unique in that it stimulates your own collagen production while it's in there. So it irritates the fibroblasts, which are the cells that make collagen, to produce collagen like crazy, infiltrate around the filler to perform, to produce a lattice work around the filler and to hold it in place and to make it even more difficult to break it down. So not only does it last longer, it stimulates your own collagen production, and in my opinion, it's better for everything, except for lips.
And this is probably what they've been doing out in Hollywood for years, right? And now we have it in Dothan.
Well, exactly. It used to be that everyone injected collagen, and collagen is not the ideal product. It requires allergy testing in most people, and we do not do collagen injections here. The hyaluronic acid fillers, Juvederm and Restylane, were a step up from that in that they did not require allergy testing. Hyaluronic acid is a product that's present in your body and in your skin at all times. So it tends to be more compatible and have less likely for an allergic reaction. The Radiesse is even more so to that degree. The calcium hydroxyapatite crystals are very similar in chemical composition to bone, and so they are biocompatible and don't require any allergy testing, and there's never been any incidence of granuloma or lump formation with the Radiesse product. We're lucky today to have our patient back for a dermal filler procedure. She was the lady who received a Dysport treatment on our last episode. So we're going to go see our patient now.
All right, let's go.
Hey, Shauna.
Hey.
Great to see you.
Good seeing you.
You're back for filler.
Right.
All right. Well, I know you've had your lips done previously. How long ago was that?
Oh gosh, that was probably 5 or 6 years ago.
Okay. Were you happy with the result? Yes and no.
Yeah.
What didn't you like about it?
It hurt.
Oh, right.
I mean,
well,
painful, bad, painful.
so whomever did it did not do a block.
They numbed me nowhere. I mean, I was totally just like this, and it hurt.
That's terrible.
It hurt
That's
bad.
torture.
I know. I said I was never going to do it again.
We're going to torture you, but not that much today.
Okay.
So I assume you had Juvederm or Restylane put in your lips back then?
It was Restylane.
Okay. I would suggest we do Juvederm. You know, they're fairly similar items, but I like the Juvederm a little bit better. It's a little bit silkier, and it's less likely to cause lumps and bumps than Restylane, and certainly in the lips, that's important.
Yeah.
You want your lips to be soft and beautiful.
Not bumpy, bumpy.
So we're also going to do your cheeks today
Right.
as well. This whole under eye area right along the cheekbone.
Okay.
And we should be able to add a good amount of volume there, improve that whole area a little bit.
Okay.
So for the lips, we'll use Juvederm, and for the cheeks, we'll use the Radiesse.
Okay.
Now for the cheeks, you don't need a dental block,
Okay.
but as you know, for the lips, you definitely do.
I do.
So what we'll do is we'll go ahead and numb you up with a lidocaine, and let that be taking effect while we do your cheeks.
Got it.
Sound good?
That's good.
All right, well,
Okay.
I've got a couple of consent forms for you to sign, and then I want you to ask me any questions if you have any about what it says in there, and I'll go ahead and get your syringes of filler ready.
Okay. So the numbing is going in the cheeks right here with the.
With the filler,
Okay.
so that when the filler gets in there,
I see.
in about 30 seconds, it will
Goes.
numb up the area, and it won't be
Okay.
uncomfortable at all. You're going to be surprised at how little injecting the cheeks hurts.
Okay.
Very little at all. All right, we'll go ahead and get you numbed up so that you can be getting numb while we do your cheeks, as we said. You're probably nervous. Everyone's nervous before filler, whether you've had it before or not.
Okay.
It's
Maybe
impossible
little,
not to
maybe
be.
little. Okay.
I mean, really, your brain knows that you're doing something that's a little bit out of the norm.
That you're having needles come
That
straight to your
needle,
face.
right. And then there's the whole dentist part of it with the block on the inside of the mouth. Nobody likes that. So
We're good.
we'll just get it over with pretty darn quickly. And then hopefully it will be all downhill from there. All right? So we'll go ahead and get you numbed up. Injection inside, and it's very uncomfortable. If I push it slowly, it's more comfortable, but then I'm in there longer, so I try to find some sort of middle ground. Your top lip should be going numb already. Doesn't take but a couple of seconds for that to happen. And then the lower lip is a little more difficult, but hopefully it will go numb by the time we start. Are you feeling the numbness up here already? Does it feel very strange, like you're about to trip over your lip?
It does.
That's usually what I hear from people. Trust me, your lip doesn't look any different than it did a few moments ago. All right, well, what we'll need to do first, of course, is clean your cheek area so that the skin we're going through is as absolutely clean as possible. Grab a couple of alcohol swabs here. We'll just start cleaning the area where the main injections are going to be. I tend to be a little bit more diligent about cleaning the cheek area because the injections are going in right along the bone. So below the muscle and certainly deeper than most of the dermal skin injections we do. So we want it to be as clean as possible to absolutely minimize any chance of an infection. And we've been quite lucky here. It's going to feel like I'm sticking my finger in your eye because I place my finger on the lower rim of the bone underneath your eye so that I will protect your eye and that there's no chance of us poking your eye or poking through the bone into your sinus or anything like that. What you may hear as I start injecting is a little bit of a popping or bubbling sound. That's usually caused by the outer layer of the bone making a little popping as the injection starts. Nothing to be worried about. I will take good care of you, my dear. So we'll go ahead and get started. I'm going to put my finger under your eye and we'll do your first injection to improve this whole area here. All right, so here's the finger in the eyeball, and here's your first injection. You'll feel the poke, but once the material gets in there, it'll start to numb from within, and you will feel significantly better. There's your first one. Can you feel it beginning to start to numb in this inside? Good. My finger again. Here's your second injection.
I can hear it.
Did you hear the bubbling that time?
I did.
Yeah, that's why I tell people about it. I don't want them to be worried when they hear something while a needle is inside of them. That's never good to make someone worry. Now the Radiesse filler is so much thicker, more like a soft silly putty, that it's necessary to manipulate it and mold it into the exact shape you want it to be. Since we're doing bolus injections, meaning just small lumps right along the bone, we want to mold them together to make a nice uniform look. So we can see a big difference already. We've put most of the volume right in here, and we will need to mold it, but I think we'll head over to the other side now and do some filling over there. So we're ready to do the second side. Be pretty quick and very similar to the first side. And we'll do the same thing with the finger underneath the eye. And here's your first injection. Doing all right?
I am.
Going a little bit quicker on this side because we're basically going to match what we did on the other side. This material is very, very moldable, and then because we're placing it right on top of the bone, it takes several weeks for your body to infiltrate it and basically lock it into place. So for a couple of weeks it will be quite soft, and you want to be very careful with it. No sleeping on your stomach, no face down massages on a massage table. Even be very careful about sleeping on your side, because it's very easy to roll over onto your stomach, and we certainly wouldn't want you to mush your new filler. It will be soft and moldable for a couple of weeks, so I tend to do most of my molding on your cheeks at our 1 week follow-up. That way you're not freshly traumatized from the needle, and it's still soft enough that we can adjust what we need to do. I have a small amount left in the syringe, and I kind of want to mold around on you a little bit first and then see what areas will do better with the last little bit. I'm going to come back around here. All right, we'll do a last injection right in this area, and we'll be finished up. It should be pretty numb by now too.
Yeah, I don't feel it.
That's it. Now we just need to do a little bit of molding, and you will be good to go in that area, and we can move on to your lips. And I like to be able to do lips with a minimum number of holes. So while the needle is very, very thin, it's long enough so that I can reach the middle of your mouth from the side.
This is when you close your eyes.
Right, and it might be best to part your lips slightly during the whole procedure. That way we can better see exactly what I'm doing. And generally, when I'm doing a general fill on someone, I will fill the outer edge and then the body of the lip with a single hole. I never start at the very corner of the mouth. Doing that really overfills the edges and can give you that sausagey look. So it's very important to start at least a ½ centimeter in on the lip to do a really fine job. It's also best not to overfill, and best not to overfill this border especially, because you can get a very undesirable look. Okay, here we go. You feeling any of that? Good. Probably much less than the last time.
Yeah.
All right? The painful last time. So we do an injection along the border, and then I go into the main portion of the lip. Put some volume there as well. How's the bottom feeling? We're about to find out.
Yeah.
Okay, you let me know if you need more numbing. You may
Okay.
feel the initial poke, but after that you shouldn't feel anything. It doesn't even look like you felt the initial poke. Basically the same thing that we did on your right side, we're now going to do on your left. We'll go right up to the peak there. Nice Cupid's bow you have, Shauna. We don't want to harm that. We just want to enhance what you've got a little bit. Down into the body of the lip. Hey,
Hi.
how are you?
I'm great. How are you?
I'm good.
Good.
So did you have a lot of bruising?
Just a little right here
Uh-huh.
and a little bit right there.
I see
Yeah.
that.
Yes. It only did it on this side. I don't know why.
Well, sometimes that's just the luck of the draw.
Okay.
So how are your cheeks feeling?
They feel good.
All right. Well, you noticed the difference, I assume.
I did.
And your lips look amazing.
I like my lips.
Oh my gosh,
I
they
like
look
my lips.
absolutely perfect.
Thanks.
Why don't I just pat myself on the back a little
you
bit?
can.
No, they look really good. It doesn't even look like you had any
Yeah.
bruising in that area
I
at all.
didn't. I had
Open
none.
up slightly for me and part your lips. Yeah, I mean, really, really good, my dear. Oh my gosh. Well, you're a
proud of 'em.
superstar.
Yeah. Thanks.
All right, let me feel on your cheek filler a little bit. Lean back for me. Let me feel on this where the bottom edges are. I just like to feel on it, make sure it's nice and smooth and that it feels pretty even. I'm not going to push on you too hard since you've got that little bruise up there. Yeah, it feels good. It definitely improves the shape of your face
I
and
think so too.
makes it very, very young looking to have some more volume right up in
I
there.
think so too. I love
Once
it.
that bruise is gone, it'll be perfect.
Thank you.
But yeah, I mean, I can tell you're trying to cover it up a little bit, but
Yeah, I am.
it looks like
Somebody hit me in the face.
just a little bit, not too bad. All right, very, very good.
Thank
Let me
you.
know if I can do anything
will.
else for you.
I will. Thanks.
Our next show will be about Thermage CPT skin tightening, a new painless way to tighten skin with radio frequency. And we should be here next week with all of that.
I can't wait for that.
It's new at Plush in January of this year. So we've been doing treatments for a little over a month and we've gotten some amazing results. You're going to want to see it.
Yeah, forget about going under a knife yet. Do this first. It'd be amazing.
We'll see you next time.
Bye.
This has been Plush Tonight with Dr. Amanda Bell. Thanks for watching.